Hello and welcome to Brevendri and today we'll be discussing about the basic terminologies in the veterinary anatomy and in this series of videos we'll be discussing these things in different videos. So let us start with descriptive terms in some anatomical planes, some terminologies and some introductory part of the veterinary anatomy. Well, there is a one person, John Collins, who said that until and unless we are not using the new technologies in the teachings, new pedagogies in the teachings, we will have the inadequate knowledge of anatomy. And evidences are there that until and unless we use that new technologies for teaching the anatomy, we lay behind in making the students and other people understand about the importance or about anatomy or about the knowledge of anatomy. So one should use the technologies and new pedagogies for while just learning the anatomy. This will increase the learning potential of the learner and the people who will be teaching as such. So what is basically anatomy and why it is so important? And you know that this anatomy is basically the branch of the science that will be dealing with the normal structural organization of the living things. So this anatomy basically is divided into three parts. You have the human anatomy, then you have the animal anatomy, then you have the plant anatomy. So wherever in which your field you go, you can find the anatomy as a core subject, as a first subject to teach and first subject to learn. So the importance lies that the anatomy forms the core of the almost of all the broad areas of the biology. So in the anatomy, what we teach and what we learn is basically the normal structure and the function or the normal recognition of any structure. So one should understand that the normal when we study the normal structure of any individual, any animal or any plant or any part of the body, and this is basically the anatomy. And it is abnormal structure when we study that becomes the pathology. So one should always remember that in anatomy we study the normal structure of any living being. So the how the this human anatomy or the animal anatomy came into existence. If you just see the Greek derivation of this anatomy, it means to the dissection or I cut up or cut open. Basically, this has been derived from the Greek word anaton, and this means ana means up and tom is cut. So this anatomy basically is studied while going for the dissection of any type of plant or any type of animal or human beings. So that's why the terminology is like that. The definition is like that. That is to study while cutting, to study while dissecting the things, and that becomes the anatomy. And this anatomy is basically the scientific study of structure of organisms, including the systems, organs, and the tissues, and the topographic locations, the different formation of the this body parts basically includes anatomy. A totally different subject from that of physiology and the biochemistry, which deals with the structure, which deals basically with the functions of the body and some chemical processes that we study in the biochemistry. The history of anatomy goes very back some 2000 years. Ancient Greeks used it to study the anatomy, and this anatomy is basically has a close relationship with that of embryology compared to anatomy, even with that of phylogeny and evolutionary biology. And this anatomy, I told you that can be studied both by invasive and the non-invasive methods. Invasive method means that when we use to dissect the animal, use to cut the animal, or any human being, usually we dissect that and study the anatomy. That is the invasive method. Non-invasive means when we use the technologies, the latest technologies, in order to describe the same thing what is there in the invasive method, that those become non-invasive techniques. So be it the non-invasive or the invasive techniques, the one should have that capability of obtaining the informations, and the goal of every individual who is studying the anatomy is basically obtaining the information how an individual, how an organism, or the how an organ is made, or how the systems are made in the body. So these two pictures depict us, one is the invasive method, one is the non-invasive method. So in the invasive, in the left side, where you see the this head and neck of the calf. So this is why we have used this by dissecting the calf and locating the different parts of the body. Like you can find here the trachea. There is the muscle as a masseter muscle. And there is the vaccinator muscle. Then there are the this thoracic vertebrae, spine process of thoracic vertebrae. So all these things we can study by the invasive method also, that you called as the dissection. While on the right side of this, you can see the X-ray taken from any human being, which shows the different types of vertebrae along with these spinous processes and different types of the muscles it will show. So both the by invasive or the non-invasive methods. So one should be getting the information about anatomy, and nowadays we are using the latest technologies, and one of the technology is the radiographic anatomy, like ultrasonographic anatomy. So different ways we are using the anatomy, where we are just going to or to stop the invasive or the unnecessary killing of animals or the human beings, or like that, for the study purpose. So not much going to the history, but it is very old science. Some 1600 BC, you have the papyrus. He is known for the description of the anatomy and the various organs of the body, the heart, the liver, the spleen, the kidneys. Then there are Hippocrates is also, he is very good in describing the skeleton and the muscles of the body. And then if you just see here, the Herophilus and Aristocratus, these were basically the have given the anatomical description by dissecting what you call the vivisection of the criminals in the Alexandria during the Ptolemaic dynasty. So people in the old age were using the animals or the human beings for the dissection purpose to study the anatomy. Now in the medieval to early modern, usually the is usually the progress of anatomy as a study or the, as a research was very low, but it gained its momentum after the 1500 onwards. So you have the Andrew Vizalis, which is considered as the father of the modern embryology, and he has written a book, The Structure of the Human Body, where he has described the each and every part of the human body as an anatomist. And if you see in 1583, a long back, usually there were the company as company of barbers and the surgeons, then the Royal College of the Physicians. They usually have their lectures, and in those type of lectures, the anatomy was the first lecture to be given, and that become that by this we can see the importance of the anatomy, where the importance has the upper hand always, and this anatomy always I tell you that become this for your any type of degrees, be it the medical or be it the veterinarians. This becomes the firm basis for your future the studies, be it then the medicine or the surgery or any type of study you go. The anatomy forms you basic skeleton of your studies. So whatever the anatomy we study regarding the fish anatomy, amphibian anatomy, anatomy is always there. So vertebrate anatomy, we studied the anatomy. Invertebrate anatomy, we studied the anatomy. So this is the importance of the anatomy, where the anatomy is related to almost each and every species of the universe. So before just going to the actual topic of the today's lecture, let us see one of there is a rough assertion that what he claims that people who don't know the anatomy basically usually are not well qualified doctors, and many other times the companies, the insurance companies or the other companies, the banks who are uh, guaranteeing the insurance to the animals or the human beings, they have to pay a hefty amount as insurance amount to the people because of the damage that is caused by any type of the surgeon who doesn't know the type of who doesn't know the anatomy as such well. So one should understand and usually know the anatomy very well for any type of the surgical procedures and other things. So the things which we are using in anatomy, so we have started teaching the anatomy by using the chalk and the blackboard. Nowadays, we have the latest technologies. We have come up to like that of the virtual anatomy or the augmented realities, like that of wise. But it started like that of the chalk and black board. It starts with, then there is a plastinates, then becomes the models. Then we have the ultrasound, this imaging or the X-ray imaging. Then there's the dissection types of things. So there are the so many ways by which they become the invasive or the non-invasive techniques. So you can study the anatomy, and one should be have the availability resources, whatever you have at your place. You should have you should be very well about knowing about the anatomy as such. So these are the some traditional methods. This is a dissection method we were following. Then ultrasound imaging, you have the ultrasound image at your hand, and you can just very well locate the different topographic positions or any type of anatomy of any type of organ by looking just simply on the this ultrasound image. Then you have the plastination where we use the silicon sealants or epoxy resins to create the plastinates or the samples of the animals for the longer lasting for these samples or these organs or these animals by the way of the plastic. This is a big procedure of plastination, no need to discuss here. But this is a way of preserving the specimens for longer use without preserving these specimens into the formalin. So now let's come to it as what definition, what basically this anatomy mean. What I told you that this anatomy basically means when we study the normal structure and the form of any type of individual, any type of organism, that is called as anatomy. And Andrew Vesalius, what I told you, is considered the father of the modern anatomy. What he said that anatomy should rightly be regarded as a firm foundation of the whole of art of medicine. What I was telling, the application of anatomy, that means the firm foundation of your degree, be it you are the human medicine or the veterinary medicine, is the firm foundation of your whole of your medicine or any type of thing. The anatomy should be there always. So branches of anatomy, you have the one of the anatomy as the gross or the microscopic anatomy, where you study by your eyes, naked eyes without using any type of aid. When you use the aid to study the anatomy, you become that type of anatomy. You call it the microscopic anatomy. Like you use the microscope for studying the anatomy, so this becomes the microscopic anatomy. Then you have the developmental anatomy or embryology, how we are make or how the animal is made from the zygote up to its final stage, that you call as the developmental anatomy or embryology. Then in this embryology or developmental anatomy, you have the one term that's called ontogeny, means how the study of the development of any type of individual basically is ontogeny. And when you see the phylogeny, basically there is one law that is ontogeny recapitulates phylogeny. A very famous scientist has given, Ernest Haeckel has given this ontogeny recapitulates phylogeny. And phylogeny means you study the evolutionary history of any development of a different type of species. If you look out on the right side, you have the development of or the evolutionary history of the modern Icus as a horse, and it has come from a very long back. It is evolutionary history. So this is basically the phylogeny. So here the ontogeny, phylogeny, if you look out on this picture, what I have here, just masked here, a part of this picture is that if you see, these are the initial stages of the development of almost 2 or 6 species. But on this basis, we cannot differentiate. If you take this embryo at this level outside of the mother's womb, you cannot differentiate whether it will become the human or it will become the fish or it will become the bird. So this is basically the ontogeny recapitulates the phylogeny. Now, if you I'm removing this, you just see the fish, how, and salamander, turtle, chicken, rabbit. But at the initial stages, almost all that is what you call as ontogeny recapitulates the phylogeny. Now you have the comparative anatomy. Basically, when you compare the between the species, when you compare the anatomy on the basis of bodily structure, how it is made, what are the different differences between the species, that is basically the comparative anatomy. Spatial anatomy, if you go for a single anatomy of a single species description, you make it a spatial anatomy. And if you go for the structure and the more form of any type of animal without regard to just function, what he's doing or what the animal is doing, that is the morphology. And when we apply the anatomy on the veterinary animals or the domesticated animals, you call that as veterinary anatomy or the domesticated anatomy. So systematic anatomy, you have the anatomy when you study of the system, like you study the osteology, it is a description of the skeleton of the bones and the cartilages. Then you have the syndesmology, or you have, so you study there the joints, the formation of joints. Syn means joining, desmo means ligaments, log means study. So this other meaning of the orthology means study of the joints. So these joints are joined together by the desmo means ligaments. That's why the other name of the orthology is the syndesmology. Then you have myology. Myology means when you study the muscles of a body of any type of animal or human being, it is the myology. Myology includes not only the muscles, along with its accessory structures. You have fascia, you have the synovial membrane is associated with the muscles, and the study of both the muscles, synovial membrane, and even the fascia, you call it as a myology. Then splachnology, description of the viscera. So description of the viscera is the splachnology, and then you have angiology. You have angiology, that is the description of the organs of the circulation. It's not only the heart, it is the heart and the arteries, the veins, the lymphatic vessels, this everything that is regarding with that of the angiology is known as the study of angiology. Or then you have the neurology, that is a description of nervous tissue. So when you study the brain and its related structures, that is comes the neurology. Aesthesiology. Aesthesiology means description of the sense organ. You know, there are the five sense organs in the body, and when you study the anatomy of these sense organs, this becomes aesthesiology. Then integumentary science, you have when you study the skin and other things of the body, and that becomes integumentary science or the skin. Topographic or the regional anatomy, you just describe with the position, the relationship, and the arrangement of the body parts, and that basically is the regional anatomy. Then the applied anatomy. So after studying the anatomy, when you just deal with applying this anatomy for clinical point of view, for physical examination of of your patient, you apply the anatomy there. That is basically the applied anatomy. whatever we are whatever we'll be talking about the anatomy, it is not my own. There are some of the rules in the regulation by which we have to follow accordingly. Whatever the terminologies I have described, or whatever you are going to study in the anatomy, basically there are some rules, and the rules are given by Nomina Anatomica Veterinaria, and that was first introduced in 1968 and then revised in 1994. So anatomical language, what we will be speaking about the different terminologies, different descriptions of the bones, the muscles, or any type of organ will be according to this nomina anatomica veterinaria. So likewise, if we describe the different directional terms or the planes of the animal body, you have directional terms that's a dorsal, that becomes the backside or away from the ground is a dorsal in case of animal, because they are the quadrupeds, unlike we are the bipedal humans. So ventral becomes towards the ground, anything that is towards the ground in the body, that becomes the ventral. Then cranial becomes towards the head, then caudal becomes towards the tail. Then the rostral vein is anything that is directed towards the nose, that is the rostral. And then distal. If you talk about distal, usually we'll use while describing the limbs, bone limbs. We have the proximal and the distal end. Distal is again towards away from the body. Proximal end of the bone is just the limb is towards the body. And dorsal, when we apply dorsal, and basically is the backside of the fore limb and the backside of the hind limb in case of the animals, and the front side of the manus region basically is you call as a palmar, and the front side of the pes region on the back side you call as a plantar. And then you have the these planes that are cutting the body in the different planes. You have the median plane, that means the plane that will be dissecting the animal body into exact two halves. Then a parallel plane that goes along with that of the median plane also cuts the animal into two halves, but the one half will be bigger, one half will be smaller. So that is the difference between the median and the sagittal plane. Then you have a plane what you call as the dorsal plane, and the dorsal plane basically cuts the this animal body into the two parts, upper part and the lower parts. So these are some of the planes by which you can just describe the animals, describe the different parts of the animal, like this is present in the dorsal plane, this is present in the median plane. So this is very important for describing any type of things in the animals. So this is the position of domesticated animals, which are going to study in this in these lectures about how what is their zoological position in the system, phylum, subphylum that you all be knowing, and you will be studying about the canidae, that is a dog. We'll be studying about the cat, Felidae. We'll be studying about the pig, Suidae. We'll be studying about ox, sheep, goat, that becomes the Bovidae. And we'll be studying about the horse and donkey, that is Equidae. Then we'll study about the rabbit, Lepordae. And we'll be studying the fowl, that is Gallinae. So all these 1, 2, 3, 4, 5, 6, 7 species, anatomy of the 7 species will be studying. So before going further, we have I told you that the study of the bone you call is osteology, and you see the structure of the bone. Basically, the bone has two parts. One is the middle part, you call it the shaft or the diaphysis, and the two ends you call the epiphysis. And if you give the cuts longitudinal cut section to this bone along its axis, you will find that the two ends will have this spongy bone without any medullary cavity or without any there will be a small part of the more bone marrow, while in the central part diaphysis you will have the cavity which will have is known as a medullary cavity, and which it will contain the bone marrow. And plus the difference when you go for the histological differences, you will have the Haversian system in case of this compact bone, but this Haversian system is absent in case of the this spongy bone. You will have the Volkmann's canals in the compact bone. So there are some of the differences by which you can see between the compact bone that is present in the middle part diaphysis, and proximal part there is presence of the spongy bone. So these 7 species, you just see the number of the bones in the different species. You have different variety number of the bones, and you have some important some special bones. You call them the visceral bones. But this visceral bone basically is a misnomer. The appropriate term is the heterotropic bones. You have the bones that doesn't form the part of the skeleton. You call them the visceral bone, heterotropic bones, or the splenic bones. Like you have the two bones in the heart of the ox. You call them os cordis. You have the bone in the penis. You call it as os penis of a dog. You have the in the rostrum or in the nose of pig. You call it os rostral. You have the bone in the eyes of between the corneoscleral junction of fowl, you call as os opticus. So these are some bones that doesn't form the part of the skeleton, even though they are present in some species. So some of the osteological terms that you will be seeing along with these videos is like there is a one spine. So what is a spine? Basically, this spine is an elevated ridge of any type of the bone. You just see here, the surface of the bone is divided into two parts by this elevated area, and this elevated area is known as a ridge. Then on this side, you can see of the scapula, you will see a small blunt rounded projection. You call it a tubercle. And because of this elevated area of the ridge, this surface of the bone scapula is divided into two parts. One part, this part becomes higher than this part. So this big part is little bit what you call as at the lower level than that of the other part of the scapula, and becomes a shallow depression, what you call as the fossa. So this is the fossa, shallow depression. This is a small blunt rounded projection is tubercle, and elevated ridge you call it as the spine. Then tuberosity, you will have the second degree of tubercle. After this, the tuberosity, a large rounded blunt projection. Remember, a blunt projection is the tuberosity. Then you have the crest, a raised prominent line, lower than that of a ridge, smaller than that of a ridge, or a little raised than that of a ridge. You call it as the crest. Then you have the articular areas in some of the bones, a knuckle-shaped or rounded articular projection, as you call them, as a condylus. And on the sides of the condylus, you have the non-articular areas, which doesn't help in the formation of the joint. They are simply for the attachment of different tendons and the ligaments. You call them as epicondylus. So condylus and epicondylus, the difference is that the condylus are articular, which help in the formation of the joint. Epicondylus are the non-articular. Then you have one more example as a trochanter. This is the highest form of that this process. You have you have tubercle, you have tuberosity. Then the highest form is the trochanter, a very large, irregular, and the blunt tuberosity, blunt process. You call it as a trochanter. Then any globular structure in the body of a bone, you call it as a head. That's why the heads are the globulars. You call them as a head. Then the fossa, a shallow depression, which you have already discussed, that is called as a fossa. Then the facets usually present in case of the radius, you have the irregular, nearly articular surfaces, smooth, nearly articular surfaces. You call them the facet. This facets, you have the facets. You just see the facets for the this what you call as carpal bones. You have the proximal row of the carpals here. The median carpal will articulate. So this is the facet. Then you have the deep fissure in some of the bones. You call them as a groove, like you have the bicipital groove in the humerus. Then ridge, what I told you, the long, narrow, raised margin, just higher than that of uh, you call just raised margin. You call it the ridge. Then bony depression, articular and bony depression. You call this as a notch. You have a similar notch in the ulna. Then the foramens, you have the biggest foramen in the body, that is obturator foramen, hole or opening in the bones. You have the foramen is in the body. Then the second largest foramen is you have the foramen magnum. So these are the holes or the openings. So this was about the description, just small description about what we are going to study in the future lectures, in the future videos, just to give you just a brush up about the terminologies, different terminologies, what we are using in the anatomy, what we'll be using in the anatomy, and what is the importance of the anatomy. Thus, you can just see this lecture, you can log on this channel, Veterinary Anatomy Brainry. Here, the description of the channel is given. You can log on, and you can see these videos. And if you have any questions, you can put the questions on there. Anywhere you just message me. You have any questions, any suggestions about these videos, and very thank you.